We're not gathered here today by chance. We're here by conviction, shared purpose, and a collective refusal to accept the limits imposed on us by an outdated global health order. We're here because we choose to lead reform, to heal, and reimagine what our healthcare systems can be. This summit comes at a time of overlapping and intensifying global crises. We have wars, we have pandemics, we have climate shocks, we have economic volatility, and widening inequalities. And these are not just testing our systems, indeed they are exposing where the fault lines are. The world has changed, but global health governance has not kept pace with the changing world. At this moment, we're called to redesign the architecture that has for far too long excluded Africa's voices, excluded Africa's needs and innovations. We're called to build systems that do more than respond to crisis. We must build systems that generate resilience, produce equity, and amplify dignity of our people. Let me be clear. We've seen profound global health achievements over the past decades, that is true. And let us honor those successes. For instance, child mortality has been halved since the 1990s. Maternal deaths have dropped by over 40% since the year 2000. Over 29 million people now have access to life-saving antiretroviral treatments. Millions are living longer and healthier lives due to cleaner air, better sanitation, and innovative health systems. These gains have not been by accident. They've been the fruits of bold partnerships like Gavi, the Alliance for Vaccination, the Global Fund, PEPFAR, unfortunately, that's part of the program that has been cancelled under USAID, and many others. But even as we celebrate, we must confront the truth. These gains are now under siege. In 2023, global development assistance declined sharply, and Africa felt the shock. Africa must no longer be the patient. It must be the driver. It must be the author. It must be the architect and the advocate of its own health destiny. Let us remember that Africa is not new to global health leadership. When HIV and AIDS ravaged our continent, African leaders like President Olusegun Obasanjo and the late Kofi Annan of blessed memory helped catalyze global responses that birthed the Global Fund and Gavi. When Ebola struck West Africa, President Ellen Johnson Sirleaf and her colleagues became a moral compass for the conscience of the continent. During COVID-19, President Cyril Ramaphosa rallied the African Union into collective action on vaccine access. Today, President William Ruto is leading the charge to eliminate malaria as a continental scourge. Today, President Kagame is the African champion on domestic health financing and is leading advocacy in building resilient, self-reliant African health systems. We've built enduring institutions like CDC, Panabios, the African Medicine Agency, that are not merely bureaucracies. These are symbols of an emerging African health ecosystem that is rooted in digital innovation, it is grounded in data, and designed for self-determination by African countries. Your Excellencies, ladies and gentlemen, here in Ghana, we have not stood still. We have uncapped our National Health Insurance Scheme financing, opening a fiscal space of about 3.5 billion cedis more for broader and deeper health coverage. We've launched the Ghana Medical Trust Fund, otherwise called Mahama Cares, a sovereign innovation mobilizing public, private, and philanthropic capital to tackle chronic disease burdens like hypertension, diabetes, and kidney failure. Our launch of our primary health care program in the coming months, along with the recruitment of community health volunteers, will improve the general health and wellness of our citizens, marking a significant step forward in preventive care. And that is where DG Tedros has promised to help us. But let me share one real-life story, And this is of Akosua, a young mother in a town just not too far from Accra called Dodoa. She survived childbirth complications because the CHIPS compound she attends was digitally linked to a regional hospital. And so in real time, she had a real-time referral system that saved her life in childbirth despite the complication. A digital prescription platform ensured that she received the medicines that she needed without delay. This is not a vision of the future. It is present reality of health sovereignty in Ghana. We are not merely reacting to emergencies, we are building systems that create jobs, reduce inequalities, and uphold the dignity of every Ghanaian, no matter where they are. Health is wealth, and we must reframe the economics of well-being. We must reject the outdated notion that health drains our economies. In truth, health is the engine of productivity and bedrock of inclusive growth. The WHO has shown that for every $1 invested in health resilience, it yields up to $4 in returns. This return is even greater in Africa, where youthful populations represent latent economic dynamism. And so every malaria case that is prevented is a day of work that you have regained. Every maternal death that is avoided is a family that continues to remain stable. Every vaccinated child is a future you have secured for your nation. We must therefore urge our ministers of finance, and I'm sad our Minister of Finance is not here, to treat health as a capital investment, to encourage sovereign wealth funds to allocate resources to biotech, to diagnostics, and resilient infrastructure, to call on economists to revise national accounts to reflect health as productivity multiplier and not a consumption expense. And so I suggest that we act decisively at 3 levels. And the first one is that globally, we must champion a new health governance architecture that reflects a multipolar, digitally interconnected, climate-challenged world. Health governance must be democratic, it must be just, and it must be fit for the 21st century realities. The second one is that regionally, Africa must scale up its homegrown solutions. The Africa CDC, the African Medicine Agency, the African Continental Free Trade Area Health Corridors, and the AUDA NEPAD Resilience Agenda. These are all things that we need to scale up. And then nationally, we must execute not merely plans. This requires political will, domestic resource mobilization, and as DG Tedros said, effective leadership. So success is going to depend on our scaling innovations like PanaBios for digital health verification and pandemic preparedness, Proper for transparent medical supply chains, and BioNovac to transform vaccine production from molecules to the market. And what are the new commitments? Today I'm pleased to announce 2 significant commitments. The first is the Presidential High-Level Task Force on Global Health Governance. This will be a convening platform to engage global and continental partners to redesign the health governance systems for the world we live in now, not the world of yesterday. The second will be the launch of the Sustain Initiative, and this means scaling up sovereign transitions and institutional networks. This is a bold African-led platform that will align our national budgets with our health priorities, will mobilize sovereign, diaspora, and philanthropic capital into our health systems. It will foster cross-border learning, innovation, and accountability. And I extend an open invitation to all nations represented here to join us in building an African health investment ecosystem that is driven by purpose and is powered by equity and anchored in our sovereignty. And so, to conclude, the Accra Declaration for Health Sovereignty that we are discussing in this summit is more than a policy forum. It is a moral call to action. It is a strategic milestone and a continent-wide awakening. Health is not a luxury. It is the foundation of our freedom. It is the currency of our dignity, and it is our greatest public good. And so let the world hear this from Accra. Africa's pain is not a deficit. It is a death of perspective. Africa's healing is not a plea. It is a rallying cry for sovereignty. Our sovereignty is not isolation, it is co-creation. And so together, what should we do? Let us reset the moral compass of global health. Let us build systems that generate wealth, uphold dignity, and expand purpose. And let us not only reimagine our future, let us own it. And let us make our systems more resilient and self-reliant.